Welcome to Deuk Spine Institute. Our patient here has chronic pain in her buttock. She has a history of piriformis muscle tear. Now Jordan is going to pull the fluoro out for a moment, and I'm going to show you what I'm talking about, okay? We just finished her laser surgery at 2 discs, and she has a muscle that runs from the tailbone called the sacrum. It runs in the top of the buttock all the way down to the hip, the bone in the hip. And she has torn that muscle. It's very easy to tear by just bending over. That muscle will not heal. It just gets inflamed, come on in, and causes muscle spasms. Because the sciatic nerve runs right through that muscle, people get sciatic pain down their leg. Very common, about 95% of the patients. And that buttock pain and sciatic pain are horrific pain. Shot. All right. So we're going to get started with her surgery. It's called the piriformis muscle release. Is the leg rotated? All right, beautiful. You can see that's where we're going to make our incision. And it's a 4 millimeter incision. Henry, let's show the audience how do people get piriformis muscle injuries and how does Deuk Spine Institute fix these?
Of course. A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. You can see from our video that piriformis syndrome occurs when the muscle called the piriformis muscle tears. That occurs with certain types of movement like bending over and picking something up from the ground, but using improper posture and biomechanics, body mechanics basically. So if you bend over and twist your hips to pick something up not in front of you but sort of to the side of where you're standing, you're going to tear the piriformis muscle if you're deconditioned. Now, how do you get deconditioned? You get deconditioned by having chronic back pain that you don't treat properly, and it hurts so bad to have this pain that you basically just stop living your life normally, and you end up your muscles get weak and atrophied. So when muscles in your back and hips get weak, well, then you can injure them very easily. And when those injuries occur, you basically are going to have something like a piriformis muscle tear. Okay? So we just did our release on the left side. It went well. And I'm going to give her a little bit of medicine just to ease some of the discomfort from the procedure. This procedure has an immediate recovery. We use staples to close the incision. It's a skin incision of 4 millimeters. And I developed this technique and patented it. It is a patented surgery because I pioneered it. Now, the old-fashioned piriformis release that was being done and still is done most places in America and the world is a big cut here, and the muscle is cut in half, the gluteus maximus muscle, And then you get a big scar on your buttock and it's sunken in, and there's all this dead muscle and dead scar tissue. But with our treatment, we're just releasing the tendon of the piriformis muscle from the top of the hip. It's bloodless. There's no muscle damage. It's an amazing surgery. There's no downside. It's an immediate recovery. No hospitalization. It is truly the best piriformis release in the world. All right, hope you enjoyed. Do we have any questions?
No current questions.
Let's end the stream. We'll be back in 30 minutes or so.